My name is Andrew Katz. I'm an ENT and I did subspecialty training in head and neck cancer and microvascular reconstruction. I'm very proud of my training. I think at the University of Miami, I trained under some of the best people in the country at what they do. So I took a little bit from each of those people and kind of incorporated it into a skill set to do what I do. And then I had an extra year of training at Vanderbilt University in Nashville. The head and neck cancer fellowship at Vanderbilt is this legacy of some of the biggest names in the field, and it's just a huge bonus to have that additional training under my belt to turn around and treat patients. So one of the things that I really like about ENT is that we do both medicine and surgery. So we see patients in clinic, we do medical management, we do some procedures in clinic, and then we can do some really big, long surgeries, some small surgeries. So it's really a good mix. We see adults, we see kids, so it kind of spans the gamut of all parts of medicine. I think what's really nice about being here so far is that everyone who works here is really nice and everyone really cares, and they're here for the mission of taking care of patients. It's a smaller hospital, it's a smaller setting, and so we can really communicate easily with each other if we need to refer patients, and people don't get lost in a big system. ENT is a subspecialty of surgery, so at heart we are surgeons, but part of being a good surgeon is knowing when you should operate and when you shouldn't, and who you should operate and who you shouldn't operate on. So a lot of what we do does involve surgery, but a lot of it doesn't. For me, there's like a couple of different things about ENT that are really satisfying. So one side kind of focuses on communication. So someone comes in not really able to speak, might need some work done on their vocal cords, you can give a little injection, and someone who goes from a whisper or no voice, all of a sudden now they're going out to dinner, they're communicating with friends and families at party, and you're really kind of giving them an enjoyable lifestyle back. I think that's always satisfying. On the bigger end, I think doing really long cases, big cases, you're curing cancer. Like, that's the whole hope of a lot of these surgeries. And I think that when you're doing surgery with the hope of curing cancer, like, you never lose sight of how important that is to someone. And I think the satisfaction in your job from that is just endless.